Well, hello everybody, and welcome to the Petrie-Flom Center's annual conference. Our topic today is health law as private law. I'm going to have my co-editors and organizers start by introducing themselves. I'm Glenn Cohen, by the way. I'm a faculty director here, a deputy dean, and a professor at Harvard Law School.
Okay. Hi, everybody. So happy to see everybody here, and those who are joining online. We really appreciate you joining us. I'm Wendy Epstein. I am a professor of law at DePaul University in Chicago. I'm also the associate dean of research and the director of the health law program there.
Hi, I'm Chris Robertson. I'm a professor of law and the Neil Pike Scholar at Boston University School of Law.
Hi, I'm Carmel Shachar. I am the executive director of the Petrie-Flom Center until July 1st, and then post-July 1st, I'm assistant clinical professor of law and faculty director of the Health Law and Policy Clinic at Harvard Law School.
Hi, I'm Susanna Baruch. I'm the very brand new, soon-to-be new Carmel executive director of the Petrie-Flom Center.
Great. And we're just going to say a few words about the volume and about today. So first of all, a big hello to everybody in Zoom land. This is being a live broadcast. Just a reminder to anyone that anything you say here will be picked up live by the mic. So be circumspect if you want to be circumspect about something. Otherwise, shout it to the heavens. For the people who are in the room, some important announcements. First of all, where are the washrooms? They're around the corner and to the right. We'll be taking some bio breaks along the way, so you may need to use them. We're going to have food here. There's some breakfast, some coffee as well. We'll have lunch today. We have a really exciting day ahead of us. I also want to announce that the volume coming out of this gathering will actually be published by Cambridge University Press. It's under contract with Cambridge University Press, so we're extremely excited. So besides hearing the great contributions, you'll also be able to read the refined version. This is set up as a writing workshop, so we're basically going to have people present for 10 minutes, and then we're going to have 10 minutes of questions on each presentation. I want to introduce you to my friend, the limiter. It looks like Back to the Future Part 1 technology, right? It's very, analog, but it's my favorite piece of technology in the entire Harvard Law School. Why? Because not only does it have a countdown, it has these three wonderful lights. Green is good, yellow is and red is stop. It can also flash red, and it can make a beeping sound, right? And why I love this is while the presenter sees the time countdown, you in the audience get to see the colored lights. And when people start moving into red, it is entirely appropriate to rustle papers, look a little bit nervous, give them some shade, right? Because we want to use social pressure to make sure everybody stays on their time. People are supposed to present for 10 minutes and get 10 minutes of questions. If they go to an 11th minute, maybe an 11th and a half, we'll have some leeway, but they'll get less time for Q&A. But if they get longer than that, the limiter is going to get very angry. So just pay attention to that, and people will know. And I'll be manning it for at least the first panel. Did I miss anything important? Looking to my executive directors to say, is there anything about the logistic announcements that I should say that I haven't said?
So for those who are presenting, you have 20 minutes per contribution. We've kind of set the default to be 10 minutes presentation, 10 minutes audience Q&A. But should you want to reserve more time for the Q&A, should you want to present for 8 minutes, you can then roll 2 minutes into the questions, for example. So I anticipate one person is going to go, "Hi, I'm Jane Smith. Okay, time for questions." And then that person gets 19 minutes for questions. So feel free to move things around as you'd like, but as Glenn said, when your 20 minutes are up, we will be social pressuring you to keep things rolling since we have a lot of amazing contributions today.
Great. Question.
How do you find the papers online?
Good question. The papers are, Laura and
The papers are on Dropbox. They should be in the emails that I sent to you, and I can re-forward it right now.
So yeah, Dropbox. I'll also say that we do have microphones. This room is equipped with microphones, but still we recommend that you, if you ask a question, you enunciate and speak a little bit louder than might seem normal if you're not in front of a microphone, just because we want to make sure that people watching it online can also hear the questions. I'll also now turn to my co-editors to see if they have anything they want to add about the topic or about anything.
Yeah, so just a little bit about the topic. I know everybody knows that we're here to talk about private law in health, which is Something that in this room, the folks who are in this room in particular think about, and obviously there are lots of folks in the academy who are thinking about private law, but as we know, much of health law and policy has been focused on legislation and the administrative state and things that we consider generally under the public law umbrella. So one of the things that connects all of the papers today, and I'm really thrilled that we have such a diversity of topics under this umbrella of private law and health law, is this thought about, are the problems that we have with our current market things that can be helped by private law solutions or things that are going to be worsened by trying to apply private law solutions? So I'm hoping that we're going to get a really good debate going about, is there promise in private law and health law, or should we really be focusing all of our attention on the public law solutions? And we've got the day broken down into a number of different panels that are arranged topically, but this is kind of our overarching theme for the day. So I'm hoping that we'll kind of keep coming back to this higher level topic of, is there promise in private law, or is really that more the problem with the system than it is the potential for a fix?
Well, since Wendy referred to the topic, I'll refer to the people that are here, and that's the magic of the book, is the people and the topic that come together. I'm really struck by the range of health law scholars that have decided to share their work with us in this format. We're all seeking to have our work read, and I'm really touched by the range of folks that we have here. Some of the titans of health law who we have learned from as students, whether directly or through their casebooks, are represented here. People now doing some of the most exciting research, featured in the most high impact newspapers and in Congress and in the Supreme Court. And then we also have scholars at the very beginning of their career, in fellowships and PhD programs. So I think in addition to this time here at the podium and in the room, lunch and breaks and dinner last night and maybe a bottle of wine after the event ends are hopefully a great chance to build those connections. Not just so the book becomes greater than the sum of its parts, but so that we go forward and do more great work in collaboration. So thankful to have you here.
So I will just say I am the daughter of a libertarian, and I am a regulatory lawyer. So I think in some ways I have not made my father proud. And this book is kind of a bridge between his worldview that everything would be better if private actors could just sensibly order things amongst themselves, and to date my view that everything could use a good regulation, and looking at the Federal Register is my happy spot. And I think so far the papers have been really illuminating about when my father has gotten it right and when I have gotten it right. So I look forward to eventually handing this book to him and being like, you're not entirely right, but you're not entirely wrong, which I think is the nicest thing a daughter could tell a father.
It's quite appropriate that Carmel brought up family, because this is a very bittersweet moment. This is her last official event as the executive director. She's been a wonderful co-pilot for me for, 5 or 6 years it's been. I'm so excited for her next venture, and so excited to work for Susanna, but I wanted to at least give her a big round of applause to conclude her amazing time here at Petrie-Flom. All right, and with that, a little bit ahead of schedule, which is what we like to be, I'm going to call up the first panel.